Hello, my name is Jennifer Campbell. I'm a graduate student at Auburn University in their nurse practitioner program. Today, I will be presenting my stakeholder presentation for my evidence-based practice research on the effects of continuous glucose monitors and insulin pump therapy on type 1 diabetes patients. So for some background and significance, according to the American Diabetes Association, more than 30 million Americans are living with diabetes. Type 1 diabetes is ranked as one of the most common childhood diseases. Worldwide, 79,100 people develop type 1 diabetes annually. Less than 50% of diabetic patients receive adequate diabetes education, which is a vital element in managing the disease. The present standard of care for diabetes patients is continuous glucose monitoring by capillary blood sample and multiple daily injections of insulin. When diabetes patients are able to receive an elevated level of care with advanced diabetes technology, it can result in better glycemic control, which reduces the progression of complications. Continuous subcutaneous insulin infusion therapy allows programmed insulin delivery to include multiple basal infusion rates that mimic the physiological patterns of insulin secretion and contains flexible bolus doses of insulin for meals and to correct hyperglycemia. Continuous glucose monitors provide a more accurate, complete picture of glucose readings throughout a period of time, supporting metabolic control and detecting patterns and trends and creating a basis for an individualized diabetes regimen. My target population includes type 1 diabetes patients, adults 18 years of age and older, and patients seeking to improve their diabetes management with the aid of technology. My PICO question includes, in patients with type 1 diabetes, does the use of technology, which would be continuous glucose monitoring and insulin pump therapy, improve glucose control and decrease the risk for complications versus using standard therapy? My literature search and summary of evidence. The literature search included databases from the Cochrane Library, CINAHL, and Medline EBSCO. Key concepts searched were type 1 diabetes, insulin pump therapy, continuous glucose monitors, and diabetes technology. Search strategies included subject headings and titles between the years of 2015 and 2020 and in the English language. The summary of evidence included 10 articles that were found to meet the criteria. The articles consisted of 2 systemic reviews, 4 control trials, 3 retrospective reviews, and 1 qualitative study. My recommendations are as followed. First, a grade A, type 1 diabetes patients should have access to insulin pump therapy to decrease hemoglobin A1C levels and the physiologic strain on the body. 2, also a grade A. Type 1 diabetes patients should be recommended to utilize continuous glucose monitors to aid in trend graph and strict monitoring of glucose to decrease the potential for effects of long-term complications. 3, also a grade A. Type 1 diabetes patients should have access to combined technologies of continuous glucose monitors and continuous subcutaneous insulin infusion for best glycemic control and physiological outcomes. My setting assessment took place at the Diabetes Center in Fairhope, Alabama, associated with Infirmary Health System. They provide resources to type 1 diabetes patients, type 2 diabetes patients, and gestational diabetes patients. They're staffed with a director, a licensed registered dietitian, 2 registered nurses, and 2 certified diabetes educators. They provide group classes, meal planning, insulin instruction, exercise, stress management, and complication prevention. In 2019, 307 patients completed the initial diabetes education, and of those, 65 were type 1 diabetes patients. The Diabetes Center averages 10 patients per week, including the class attendees and one-on-one consultations. So for my summary, my patient data was collected from 6 type 1 diabetes patients interviewed, ranging from ages 18 to 50 years of age. Patients were relatively knowledgeable regarding continuous glucose monitors, which can be contributed to television and commercials. 4 out of 6 patients were aware of insulin pumps, but not educated on how to operate the device. All patients agreed that education on technology to aid in diabetes management was not a general topic of interest introduced by their provider. 100% of patients interviewed expressed interest in attending a class based on technology to improve their diabetes management. For provider input, the provider input was provided by the Diabetes Center Director. She suggested that a global gap consists of the misconception of patients and physicians of how this technology is utilized in the treatment and management of diabetes. There's also a lack of education regarding these devices, leaving the impression that technology is the cure for diabetes. Physician treatment is made easier due to the data collected by the continuous glucose monitor, an insulin pump therapy device, allowing a better record of blood glucose levels. The benefit of this type of evidence-based practice project would allow patients in the Diabetes Center to be knowledgeable of options available and their benefit. Implementing an educational resource of this nature would be beneficial to the provider to educate them on the benefit of technology with diabetes management, allowing them to make recommendations to their patient. For project implementation, the setting would be the Infirmary Health Diabetes Center in Fairhope, Alabama. Participants would include all type 1 diabetes patients referred to the Diabetes Center by a physician. For the implementation steps, first we would develop a diabetes technology education course to provide an overview of the diabetes technology. Resources for obtaining the diabetes technology to include contacting the ordering physician with recommendations on which device to select, and continued follow-up and education upon receiving the device. We would provide a once obtained the device, a one-on-one education course on the specific setup and operation of the device. Protocol implementation by the endocrinologist would be implemented for monitoring and when to consult the physician. Telephone counseling and data transmission daily via telemonitoring of continuous glucose monitors, which would also provide patients to be contacted if abnormal parameters are detected. And also, a registered nurse would follow up weekly to collect data on the insulin pump therapy, which would include the trends of highs and lows as well as the frequency. Followed up routinely by a healthcare provider for adverse events and hemoglobin A1C checks after 30 days, 3 months, and 6 months. This is a diabetes technology sample that I've created. It is a PowerPoint presentation that includes statistics about type 1 diabetes and diabetes in general, also continuous glucose monitors, the history of them, the mechanism of action of them, and as well as recommendations of 4 different types of continuous glucose monitors that each have a different mechanism of action, as well as insulin pump therapy. I have went over 3 different types of insulin pumps, what their benefits are, what may be some restrictions for the insulin pumps, as well as a questionnaire on how to decide what's best for you. So for the physician or the diabetes educator, whoever's providing the education to the patient, they could go over this PowerPoint presentation, giving them all of the information, and then help them select what's best for them using the How to Decide What's Best for You questionnaire. I've also put together a sample brochure. This would be a good quick reference guide for any physician, also the diabetes technology educator, or anyone who's giving resources to patients, as well as a resource for patients to go over different devices, what the devices are, the breakdown for insulin pump therapy, as well as the continuous glucose monitor. I've also listed out the continuous glucose monitors and the insulin pump devices that are approved by the FDA, and just a quick reference guide of the pros and cons of each. For my evaluation plan, at 30 days, I want to have an average blood glucose from the continuous glucose monitor. And then at 3 months, check a hemoglobin A1C level, as well as at 6 months, also check the hemoglobin A1C level to compare with the initial hemoglobin A1C collected at diagnosis or at time of initiation of the education program. I also want to have an expected 6-month post-implementation hemoglobin A1C goal of less than 6.5 with the combined technology. I also expect 30-day post-implementation to include a reduction in the blood glucose fluctuation and maintain blood glucose levels between 80 to 200 with number of high, and also obtain a number of lows for the target range. Physiological data from the CGM will be collected. Insulin pump data, number of calls by patients, and number of alarms by the device will be evaluated. Data collected will be evaluated at 30 days, 3 months, and 6 months. And then also for measuring the effectiveness of the implemented diabetes technology education course, protocol, and quality improvement in treatment in the type 1 diabetes patients. And then for my stakeholder evaluation, I will ask, was the presentation directly related to the diabetes center population? And if so, how? Did the presenter present the information in a manner that was easy to understand? And please explain. And how do you think the diabetes technology education course would benefit type 1 diabetes patients in the diabetes center? And if so, how? And also, I would like you to fill out the communicates well, clear objectives, and future considerations that I provided in my PowerPoint. If you strongly agree, agree, neutral, disagree, or strongly disagree. And then at this point, I would take any questions by the audience. And then there are my references.